Welcome back, everyone. I'm Dave, and this is chemotherapy number 3. This is the third part in a series about my experience with chemotherapy for multiple myeloma, the type of cancer that I have. This time I'm going to talk about the hospital, the staff, my experience going to the hospital and having my chemotherapy infusions. Every week on Wednesday, I go to the hospital and I have an infusion. Infusions are sometimes a long process where they put the medication into your body. There's a machine with a line attached to your arm and they're giving it to you slowly, and you sit in these big comfortable chairs and you look out a window or watch videos on your phone or listen to music. I don't go through that long process, but I still do go into that same place. Every week when I go to get my infusion, I go in a little early and have a blood draw. They'll usually take 4 or 5 vials of blood, and the reason they're doing that is to make sure all of my systems are working correctly. They can check the level of cancer in my body, and they can see that I still have enough platelets and white blood cells and things like that to continue the medication. If there was a problem, they would know it by the time I was in the infusion room, and they could change what they're doing with me. So it's very important. When they take the blood draw, it's just an IV. They put a line in my arm. They've done it so many times now, I'm getting used to it. Unfortunately, it took me 2 years to get used to it. I still have to hold myself from jumping. I still look into the distance and hold my breath when they put the needle in. It's really not more than a pinch. It's nothing at all, but just having a metal part inserted into your vein, it gets into my head, so I still have to look away. It's getting better. It took 2 years. I thought it would take 2 months, but it's not so bad anymore. When I go into the infusion room, it's a very busy place. There's a lot of people in there, a lot of nurses. They're all extremely friendly people. Everyone in there is so nice to me all the time. They go out of their way to come over and say hello. They offer me pretzels, chocolate chip cookies, orange juice, or apple juice. I have a very healthy diet, so I don't always eat these things. Sometimes I just put them in my bag for later. The main nurse is kind of a head nurse. I don't know what her position is called. She's the one who's going to give me the injection in my belly. The Velcade is the one that I'm going in for. I don't have an intravenous infusion. They won't put a line in my arm. It's just a subcutaneous under the skin injection. It's a big needle with a small tip, the point, the pokey part. They just put it under my skin. It takes a long time to inject it because the fluid, there's a lot, and the nurse will be talking to me while she does it. Before she gives me that infusion, she puts on a long gown that covers her entire body. She puts on a pair of gloves, and then she puts on another pair of gloves on top of that. They tell me this is because the Velcade is going into me. It's not a danger to me because I'm the one taking it, but they don't want it to get on her. They work with this stuff all day, and they don't need it in their bodies, and so they're trying to keep it off of their skin. So that's why they have this garb on. I was nervous the first time I saw it because she looks like she's getting ready for surgery. The room itself is bright and happy, and there's big windows looking out on a hillside. It's not a happy experience. We're all in there getting chemotherapy infusions. Nobody's happy to have to go through chemotherapy, but they do their best. They really do to make it a nice place. There's little decorations. There's lots of little hand-knitted things and boxes you can put on a hat to keep warm. They have blankets and things like that. The nurses are always smiling. I never saw somebody who doesn't look happy in this place. And that's it for the infusion. It takes about 45 minutes. Most of the time, that head nurse that I talked about, who's the one who gives me the injection, she's talking to me about how I feel. She's the one who's really checking in to make sure I'm not having bad side effects, that I feel okay with what's happening. She's asking me about how I feel about these things, not just how it feels in my body, but how it feels in my mind and my heart. So they take a lot of time and they give a lot of attention, doing their best to make it a positive experience. And it really does help. During that time, they're going to discuss the medications that I'm on. They'll talk to me about if my prescriptions are running out. This is where I tell them if my Revlimid is running out, and so they can begin the process of ordering it again. This is really my main communication every week with that nurse who gives me the Velcade injection. I go home after that. I drive myself. I really thought it would be a big deal. I was very nervous about it, but it's not bad at all. I don't feel bad after it happens. I'm a little nervous before I go in because I'm getting needles and I don't like needles. Other than that, it's not that I go in feeling sick. It's not that I come out feeling sick. I don't feel sad. I don't feel tired. The whole thing is really not bad. Once a month, I'll have an extra meeting meeting, and that will be with my main oncologist. I was saying previously that I was kind of hoping to see him more often, but it's really not necessary. As I learn what these people specialize in and what they're really doing for me, I know which questions to direct to which people, and I can get more meaningful answers because I know who to talk to get the right information. My main cancer doctor, the one who tells me which medications I should be taking and what my future's like, he doesn't really need to see me that often. He's just checking up. Last time I saw him, it was more just like a chit-chat about how things are going. I did hit him with a lot of questions about my future because I don't know what my future is and I'm trying to learn more. And in that conversation, I was able to ask him about the bone marrow transplant that's coming up in about 3 months. And I did actually get this big binder about bone marrow transplant, and I'm going to talk more about bone marrow transplant later. When I saw the doctor, he had the bone marrow specialist come and meet me, and that's the person who gave me this binder of information about the bone marrow transplant. The director of the bone marrow transplant part of the hospital came to meet me when I was getting an infusion. I was expecting him, and my mind triggered old habits, and I stood up. I said, "Hello, I'm Dave," and I shook his hand like I was meeting somebody in a business setting. And he said, "That's not necessary." And I said, "Oh, well, we must maintain decorum." The director of the bone marrow transplant told me, "You're in a really good place for this." The hospital I go to specializes in multiple myeloma. They have a whole floor for it. They do research on it. They teach it at the connected university. He pointed out to me, every person you talk to is a specialist in exactly what they're doing. Brings a lot of knowledge and experience into the whole process. And that's the feeling I get when I go to this hospital. Everybody knows what they're doing. Everybody knows what their job is. Everything is clicking into place. It's just moving, moving, moving. That feels good. It feels like this is obvious. This is what's supposed to happen. Nobody's confused. It builds a lot of confidence inside of me, and it makes the whole thing feel less frightening. So that's a quick look into the people and the place that I go to when I go for my infusions. I hope this is useful for you. I hope it gives you some insight into what might happen to you or what might be happening to friends who are going through the same thing. Thank you for watching. Farewell.